So I am so happy you are here. Where are you calling in from today?
I'm calling in from Los Angeles in West Hollywood.
Ah, good old LA. That's where I was born and raised, my friend, and I moved to the East Coast for some reason.
I just got here about 2 months ago, so I'm still acclimating, but I love it so far.
Okay, it's a beautiful place. I love it so much. Okay, so Justin, before we jump in here, can you share a bit if I read a little bit about your bio there. Is there anything in your own journey in the healthcare space that you'd like to share with us that I missed?
Sure, happy to do so. As you mentioned, I call myself a recovering healthcare trial lawyer. Back before the Great Recession, told all the young attorneys to go find something else to do, of which I was one. I was defending insurance companies and large corporations in the healthcare space. So I was working on the dark side, if you will. And I saw truly firsthand as a lawyer how messed up our healthcare system is. I saw all kinds of inequities, how lots of people who deserve and need care, the Hippocratic Oath says do no harm. It doesn't have an asterisk at the end saying, unless you have X number of dollars, or unless you have X color skin, or this sexual orientation or gender identity. People are people. But to be able to serve people, you have to be able to understand the cultural context from which they come, their unique lived experiences, their intersectionality of identities, and be able to have the training and to create a safe place where they can be their authentic selves and receive the care they deserve. I didn't see any of that. People weren't even talking about DEI back then. And as an LGBTQ person myself, I have experienced discrimination, even though I'm whiter than paper and present as a cisgendered male. When you experience discrimination in a patient-provider relationship, which is the most intimate relationship you can have outside of your loving partner or family, it's off-putting doesn't even begin to describe it. It's just disturbing, and it makes you not want to go back into that environment that caused you that kind of pain or even trauma. And so I thought I couldn't really do anything about it because the system was just a meat grinder, and all the lobbyists on K Street were controlling everything. So were the big corporations and health systems. And then as I lost my job as a lawyer, as all the young attorneys did, I became an entrepreneur, and for 13 years. But lawyers, they're called counselors at law, but they're really counselors of life. And so the one question that people had come up to me asking across all walks of life, across the entire country, was, where can I find a doctor that makes me feel safe? And I thought, I've had that question my whole life. Some of my family and friends have. This is a problem. And when the pandemic hit, of course, healthcare was top of mind for the world because the world stopped and we had to really think intentionally about these issues. And a silver lining of the pandemic was it put a bright spotlight on all these healthcare inequities that have been there for generations. And I thought, finally, I have an opportunity, if not an obligation, to address the issues of these healthcare inequities and return to healthcare, even though I swore I never would once I left the law. So that's sort of my healthcare journey, was people asking me that question, me seeing it firsthand, and then the pandemic having that sort of light bulb click on, saying, I can't change the entire system, but I can make a dent in it and do a lot of good.
Yeah. Wow. Thank you for sharing that. I identify with so much of what you're saying as someone who also, I love that you said whiter than paper. I hear and can present as like, a cis male, but with doctors that maybe don't understand what my lifestyle looks like, and having moments of feeling like deep shame suddenly in a very vulnerable space is incredibly painful. And it's something that motivated me to find a healthcare provider that I felt safe with. But it's inherently difficult because there isn't a simplified way. A lot of us go through word of mouth, and it's like, oh, you have a good doctor, okay, great, like, can I get their number? Like, that's how historically it's been done for people, that just to find a healthy safe environment.
But then
So
what
I'm
if
curious.
that provider moves and then suddenly you're back at
Yeah,
square one? And so
yeah,
it's not that's not a solution. It's just a Band-Aid.
yeah, exactly. And that exact thing has happened to me as well too. It's like, oh, great, now I have to do that all over again. Where do I go? And that one's out of my network, and this one, and then there's just like, it's chaos out there. It's total chaos.
Yeah.
So tell me a bit about a little bit of, like you said, if not a need, but like an obligation of creating equalityMD. And I got a little hint of why you started this. Can you tell me more about it?
Sure. As a serial entrepreneur, I built, this is my 5th company, and I've sold 3 of them. And every company that I had done prior to this had an LGBTQ element, some intentional, some not. I had a coffee business that became a safe place for LGBTQ youth, and that was just accidental. And they later became employees. We had, my partner and I had a bar restaurant, which became a safe place for LGBTQ people to go and enjoy each other's company. And that's what started me to create the Richmond, Virginia LGBTQ Chamber of Commerce and join the National LGBT Chamber of Commerce. And I've had a strong 12-year relationship with that wonderful organization. And as soon as I moved to Los Angeles, I joined the Los Angeles LGBT Chamber of Commerce. And the entire process, I had been building these incredible networks, and I became the go-to person for corporations and different organizations, nonprofits, even some colleges and universities, as to how they could incorporate diversity, equity, and inclusion into their marketing practices. And my first thought was, well, they should really come from up top, the board level, if you're a corporation, and you should have that element of DEI within your corporate culture and your corporate DNA before you talk about just marketing. Because how many times during Pride Month have you seen every corporation wave a rainbow flag, and then on July 1st, they put it back in the proverbial closet? And the question is, what are they doing for the community in October or April? And that's a huge issue. But they paid me to become a speaker for marketing, and that's what I did. And at least it was a first step. And then those corporations asked, well, how do you behave as a consumer base? Because the LGBTQ consumer market is $1.4 trillion. But it's also, how do you count that? Because not everyone's, when asked, is going to raise their hand and be counted. And that's a very personal choice. And so then when the pandemic hit, I realized I had this incredible network that, if activated in a very meaningful, intentional way, I could actually do something about the healthcare inequities that caused in 2016 the National Institutes of Health to declare our community to be what's called a health disparity population.
So why does the National Institute of Health classify the LGBTQ plus community as a health disparity population? And can you help define a little bit what that means, what the health disparity population term means?
There are different ways the NIH classifies different communities that are underserved in the healthcare space as health disparity populations. So the Asia Pacific Islander and the Hispanic communities, the African American BIPOC communities, they're considered health disparity population, but the elements for each are a little bit different. For the LGBTQ plus population, there are 2 elements that they outline. One is historic lack of access to care, and 2 are unique healthcare conditions. And it's not just higher rates of STIs or HIV, but also higher rates of cancer. More gay and bisexual men are smokers than their straight counterparts. We actually did an anti-smoking campaign for the Virginia Department of Health, and we were a marketing and media company. And there are higher rates of obesity for lesbian women, which cause higher rates of cardiovascular issues. So those are very unique to our community, and we need to be aware of that. But what they left off, and this is what I find really entertaining, is that there is historic and systemic discrimination against our community from within the medical community itself. Of course, the NIH isn't going to say that, but that's been there, because how often, it wasn't that long ago that homosexuality, just for an example, was considered a mental health disorder. The World Health Organization didn't take that off the books until 1992. So we're talking recent memory here. And during the AIDS crisis, the Reagan administration just turned a blind eye, and more American citizens died on American soil from HIV/AIDS in the 80s and 90s than during the entire Vietnam War. And people don't remember that statistic, but they remember the experience, even if they didn't live through it. And so that's why it's considered a health disparity population. And what they left off too was the fact that it's the most under-measured patient population. As I mentioned earlier, not everyone's going to raise their hand and be counted when it comes to consumer marketing if a company is trying to sell you a vacuum cleaner. But when it comes to healthcare, it's even more complicated because of that systemic discrimination. Very few are going to raise their hand and be counted, because 70% of our community has experienced discrimination, causing 30% to avoid care altogether or delay life-saving medical procedures.
Wow, there's so much in there. And I was thinking about as well that there's still the slow trickle, right? Like you brought up, the HIV crisis with Reagan, and it wasn't even until just recently, like within the past couple of months, that queer folks that identify as like men who have sex with men can donate their blood. Like that was
there's still restrictions on that, by the way.
There's still too, right? Like it's like 3 months of abstinence and all this stuff, and it's like, what?
It's the same screening process as every other blood donation does. So why are they discriminating against people when there's a national blood shortage? It just doesn't make any sense.
It doesn't make any sense. And that is happening right now, so we know that there's still a long way to go. So what impacts do healthcare inequities and systemic discrimination and data gaps, what effects do these have on the LGBTQ plus community?
Do you want it numerically or alphabetically? I mean, it's intense. It's when people don't go and see a provider, whether it's for an annual checkup. Let me backtrack. The emergency room has become the primary care physician for the nation. That's a broken system. And part of that, not all of it, is because the communities that need the most care, those underserved patient populations, and the LGBTQ community is unique in that it represents every other demographic out there. The intersectionalities of identities is powerful, and it makes us a very dynamic and diverse and exciting community. But in terms of a patient population, it's very hard to count, to measure. And when people aren't going to seek care, it not only harms the individual, particularly when it comes to mental health, but it also harms individuals and their families, their entire communities, their workplace, because when your body's not where it needs to be, it affects the mind, and that affects how you present yourself to the world, but also how you feel about yourself. And some of the most sad stories that people can talk about, or rather not talk about, or feeling, are what they're going through. They're suffering in silence. And when you suffer in silence, it's like a downward spiral, and you feel this sense of hopelessness, and that you walk with that weight like an albatross around your neck in every human interaction that you have with family, friends, loved ones, at work, in synagogues and churches. It's really sad.
Yeah, it's completely heartbreaking to hear, to experience, to witness. So how does this show up? Like you said, this can show up in every aspect of our lives, with our family, with our, in our workplace. So how do these issues present themselves in the workplace specifically?
Well, what's interesting is that as younger generations, millennials and Gen Z, and there are studies that show about 20% of millennials and up to 31% of Gen Z self-identify as LGBTQ, and 53% of straight Americans identify as allies. Those are powerful numbers. So in the workplace, as Corporation X is looking to hire the best and brightest talent, they have to be cognizant of the fact that their potential employee base wants to see their values reflected in the place where they work. Just as we as consumers, we might not buy from a company that we know has discriminatory practices, doesn't have inclusive employee benefits, et cetera. So when it comes to a workplace trying to create the best talent pool out there to remain competitive, to reduce employee churn, to attract and retain the best and brightest talent, to remain competitive, but I would also say culturally relevant to customers, they have to be able to incorporate ideas and the sacred principles of diversity, equity, inclusion, belonging, and justice into their corporate culture so they can be there for the diverse communities they're trying to attract as potential employees, retain as employees, and impress as shareholders, saying, we get it, we have our finger on the pulse of human society and culture, and we're listening and we hear you, and showcase to customers that we're here for you every day of the year, not just the 30 days in June, 30 days of Pride. And that's a very powerful thing to do, but it's very hard. I went through a Harvard Business School program for 6 months in 2021 called Accelerating Board Diversity. And I learned that the most effective way any company, or not a company that includes nonprofit, is for them to attract and retain the best and brightest talent is to institute an inclusive employee benefit package, because that showcases to the world that you are there for your staff, your employees, your customers, and your corporate culture every day of the year. And that's a powerful thing to do. It's hard, but more and more companies are starting to be given LGBTQ mandates, and they're calling me up saying, help. And I find that fascinating.
Well, right before you started talking about this, someone sparked that's in the zeitgeist with the questions here is, how can organizations ensure that their healthcare policies and benefits are inclusive and supportive of the LGBTQ plus employees' unique needs? So when they call you and they're like, Justin, help, what do you go, okay, this is the way, let me show you.
Well, the best answer every lawyer gives is it depends. But it truly does, because
was that $500 an hour for that minute just now?
I'm recovering, so I'm not. I keep my license active, but I'm not going into court every day. But fair question, and it was higher actually. But the answer depends on if it's a large corporation. Then I would speak to the decision makers. Usually, if they're smart enough to have a DEI officer at the C-suite level, an HR representative that does total rewards, benefit packages, et cetera, or some of their marketing folks, or even their CEO, and talk to them about what challenges they're going through, what goals they want to achieve, and map out a plan to get there. And of course, the best way, according to Harvard Business School, and they know a thing or two, is to have an inclusive benefit package, whether that's incorporated into the entire package for the entire employee ecosystem or as a fringe benefit. Because lots of corporations, instead of having dusty foosball tables that are cool that no one uses to attract cool young talent, they're realizing that there's a marketplace out there of fringe benefits, and they give employees $200, $500 for pet care, for helping pay for their kids' braces, or paying for inclusive LGBTQ healthcare benefits. So the answer to that question is, find the person at your company, at your nonprofit. It could be somebody who is member recruitment for an organization, or somebody who does membership benefits. If you're like a Chamber of Commerce or a nonprofit, perhaps it's community outreach and engagement, corporate partnerships, and see who you go to be that decision maker to make that institutional change, and it has to be institutional.
So for when employers are creating these packages and they're finding out the needs, the individual needs, where does the mental health component for the LGBT employee come in? What can employers, obviously, I think it goes without saying, we want employees to be mentally healthy so that they can do their job. I think that's a given. But what other benefits can the employer provide, and what will they receive in return, from having a mentally healthy LGBT employee?
Well, I'll start with the benefits first. You can actually, as a company, be more profitable by having purpose-driven profits. It's this elusive double bottom line. The bottom line is typically make the most money you can, end of story. But you can make the most money you can and do good for society at the same time. And companies over periods of time, and again, Harvard Business School's done a lot of studies on this, actually do better than their competitors that don't have any kind of environmental, social, or transparent governance, ESG or DEI component. And it takes hard work to put those into place. But one tactic that's not hard to do is to have an employee resource group, a group of individuals who identify as LGBTQ or allies, get together either on site in a structured, regular format, off site in more social settings, a mixture of both, depending on the type of organization, nonprofit, mid-sized company, large corporation, but make that a part of something and encourage. You can't mandate employees do these things, but you can encourage them. And by showcasing that you support this, that they fund it, that they allocate resources, actual dollars and cents to the leaders who start these groups, that becomes a safe place. And then start promoting that in everyday life so that it's not just sort of siloed. Oh, here, your LGBTQ employee resource group, you meet in this dark corner with stale cookies and Kool-Aid. No, that's not how you do it. You make it front and center, and you make it that's a good start, because it showcases that you're actually starting to care. But then you have to listen and do a listening campaign. You can do anonymous surveys, send out emails, and get back. What do your employees want? What would make them feel that they belong? What would make them feel that they could bring their full authentic selves to the workplace? Because you can't just assume. You have to ask, and you have to ask intentionally and with open eyes, open ears, open heart, and with true empathy. So there are lots of mechanisms that you can do, but you have to have an open heart, open mind, and put money where your mouth is and showcase every single day.
Yeah. Are there some examples that you can share with us, perhaps, of businesses that you've worked with that really took this to heart, were successful, some things that maybe were fun or surprising to you that came out of some of these ERGs and putting stuff front and center?
Capital One did a great job with this. I worked with them. Their employee resource group not only grew, but it went from sort of being off to the side, not like in some dark, dingy basement, but it became part of the, I hate to use the word mainstream, but in terms of Capital One, it became part of everyday life, as opposed to, oh, only on the third Thursdays we'll get and have punch over here. It became part of everyday life. And the more you can integrate that into your culture, the better. The American Civil War Museum, we helped transform into an LGBTQ wedding destination. Can you imagine? But they recognized that, okay, not everyone's a history buff, and the American Civil War brings with it all kinds of issues that we're still wrestling with to this day. But that includes LGBTQ issues because of the intersectionality of identities that's unique to our communities. And being able to, now the Civil War Museum doesn't necessarily have an employee resource group, but they realized they had a venue, an incredible piece of property with rich history that if they showcased it authentically, and they did a really good job a few years ago of redoing their facility in Richmond, Virginia, but opening that venue to everyone inclusively. That was a wonderful example. Hotel companies, Hilton and Marriott, they both are great, but we work more with Marriott. And there's an example. There's a hotel in Virginia Beach, because I came from Virginia, and they said, how can we say a same-sex couple comes here and they have a wedding on the beach and it's beautiful and romantic, and then they go up to the bridal suite, and I say, why does it have to be called the bridal suite? Why gender the room? Why not call it just the honeymoon suite? It was like I just showed them the nose on their face. And sometimes you have to, but we also they also took it to heart when I said it has to come from the CEO down to the bellhop or the person checking you in, because at every touch point you have to create that inclusive feeling, and that example translates exactly into the healthcare space, from the waiting room to the emergency room, everywhere in between, and everywhere after that. Say you're going through therapy, you see a therapist every few weeks, or you're taking medication, you're talking to a pharmacist. You need to make sure that at every touch point you create that intentional inclusivity.
Yeah, I love those examples. Those are so great. And with just a couple of minutes here to wrap up and, to bring it back to healthcare, can you share a little bit about how equalityMD does that with each step of the way?
Sure. So we started off by taking, much like a dating app, we have patients fill out a profile and have a very inclusive questions from sexual orientation, gender identity, languages spoken, culture, etc. And then you get to create your ideal profile, a provider profile. In our machine learning matching algorithm that we've coded, provides you a list of providers that are allowed to see you via telehealth, because they have to have a license in the state where you live. And then you pick the doctor you want based on the preferences that you've identified. So you're in the driver's seat. You have agency, autonomy, and in healthcare, that's unheard of. And what's powerful about that, no matter who is provided in the list that you're matched with, that you're seeing on our platform, they have gone through federally funded, evidence-based LGBTQ cultural competency training. So they might identify with the community, they might not. But either way, they have gone through that training and received continuing medical education credits, so that you know that they have been trained to create a safe place where you can be yourself. And when we've done some pilots with patients, they loved that on day one, no matter who they were matched with, who they picked, they were in control, and they saw a provider, and some of them saw providers for the first time, which was so heartwarming. And providers loved it because they said, we want to communicate and reach out to this community. We don't know where they are. If we do know where they are, we don't know how to communicate with them in a way that will change how they perceive us as providers. And so we served as a marketing engine for them and brought patients to their digital front door. And that's the telehealth part. The other part is data analytics. That sounds really boring, but it's actually really important. Because if you can't count a patient population and understand from a metrics component how our community behaves as a patient population, you can't understand what they're going through. Maybe certain geographic regions and zip codes are going through certain healthcare issues, and they're going through certain treatment regimens, taking certain medications to help alleviate certain symptoms or what have you. Pharmaceutical companies, medical healthcare technology companies like Boston Scientific, insurance companies, health systems like Cedars-Sinai Hospital, having this knowledge will help better inform them as they go through the cultural competency training, saying this group of people in this geographic region are suffering more so than, say, in this region. We need to focus our efforts in this community and communicate with them in this way because of the intersectionality of identities. Maybe that's in a different language. And without that data, they're just throwing darts at a wall in the dark. And so that hasn't worked. It never works. And so by providing that data, and no one will ever know who you are. It's all HIPAA compliant. The most information they'll ever know from us is your zip code. And having that information is very powerful and can actually drive better results for you. Higher patient engagement, better patient outcomes. And that's what our goal is.
Oh, fantastic. And is it still in the pilot or is it launching?
It's launching this summer in Southern California. What we're selling is a big promise, and I know that. And I never like to make a promise I can't keep, but I do my absolute best, and I have people with me that I'm so privileged to work with. The former chief operating officer of Capital One is my chief advisor. And the third developer at the Grindr dating app, he's creating our user interface and our user.
Oh, I love it. Swipe right for your doctor, and
more or less, but
yeah,
the Grindr part doesn't matter. He gets our community.
Exactly.
Of our 6 employees, 5 are LGBTQ, and my chief technology officer, his father came out later in life, and he's a transgender sister, and he's seen the challenges they faced, and he says, "I'm a straight ally," and I say, "Enough is enough. Where can I help?" So we're going to create a product, and we're this close to launching it, that will help change how our community perceives care. But those early customers that we get are going to be the most important, because we were going to rely on their feedback. We want to hear everything, good, bad, or ugly, that we're doing, so that we can improve the experience. Because we're not building it for ourselves. We're not building it for Blue Cross Blue Shield or even Cedars-Sinai, but we're building it for the patient, because we are the patient. We've all experienced the discrimination that we're going through, and that's how we can build this authentically and inclusively. And we want to make sure that you, the patient, are the superhero of your own healthcare story. But we can't do that without your help. So work together so that we don't have to rely on word of mouth. It's only a swipe away.
Yeah, awesome. Thank you so much, Justin. We're out of time. I'm so excited for equalityMD to launch. Thank you for your time today and your insight on this topic. I really appreciate it, and I hope we get to do it again. Please come on back to Power to Fly.
Thank you. This has been fun, and thank you for the opportunity.
Yeah, have a good one. Take care now.
Bye-bye.